The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, Mommy Makeovers. With us, we have an expert on the topic, board-certified plastic surgeon, Dr. Cedars. Dr. Cedars, welcome to the program.
Nice to be here, Randy.
Now, you brought a lot of photos, so we'll get to those. And by the way, they look pretty good. We took a look at them in the green room. Before we get into today's topic, let's talk a little bit about your practice for those people that don't know you, like your typical patient, the type of procedures you do, things like that.
People come to see me because they want to look better.
Okay.
And to me, in a deeper sense, this means they want to feel better about who they are. They want to feel better about how they look in their clothes. They want to feel better about how they look without their clothes.
We talked on the phone. You say, women want to look sexy. That's why they get mommy makeovers.
Everybody wants to look sexy. Yeah. We all want to look good. We all care about how we look. People sometimes criticize plastic surgery as being about vanity, but we all care enough to dress nicely, comb our hair. So looking good is part of how we communicate to the world who we are.
So moving on to today's topic, Mommy Makeover. What defines it?
Randy, pregnancy takes a real toll on women's bodies. And usually we would use the term Mommy Makeover to describe a lift of the breasts and perhaps a tummy tuck. But different women respond to pregnancy and nursing in different ways. And they have the effects on their body that affect them physically in different ways, affect them psychologically in different ways. And so we try to tailor the treatment to the individual person. It might involve some work on the face. It commonly involves work on the breast, and it commonly involves work on the tummy.
And so Mommy Makeover, is that one of the most popular procedures right now?
It really is. Mommies come in all ages, and once a mommy, always a mommy. So really we're talking about the changes that occur in women's bodies, not just from pregnancy alone, but also in part from the aging process, hormonal changes, the difficulty that all of us, men and women, seem to have in keeping our weight under control as we get out of our 30s.
Now, when they go in, because we've talked, they tend to, I guess, confide in you, spill their guts. What are their concerns? But what do they say?
I had a woman come in, 30 years old, came in with her husband and said to me, Dr. Cedars, I've had 3 pregnancies. After the second pregnancy, my body changed. And no matter what I did, I couldn't get it back the way it was before. I had loose skin. I had stretch marks. I had this pooch that went all the way across my tummy. And I exercise 5 days a week. I'm very physically active. My weight is good, but I can't get it to go back to the way it was. And she said, while you're at it, can you do something about this lump of fat I have on my hips that goes around onto my back? Okay. These are very common concerns. The shape of the tummy, the extra skin, stretch marks. Women look in the mirror and they say, what happened to that person? What happened to my body? What happened to me? I don't look like I used to. They still want to be pretty. They still want to be sexy.
Do you find that they avoid things, like going to the beach, or avoid things in their lives, avoid events, because of their self-esteem, or because they don't like the way they look?
Sure. Women and men change their behavior depending on how they feel about themselves. And these changes can occur slowly. They can kind of creep up on us. And all of a sudden we find, gee, I'm not going to the beach anymore. Or when I go to the beach, I'm always wearing a top. Or I can no longer wear that little black dress that I used to like to wear to cocktail parties.
Okay, now you brought some photos. What are we looking at?
I did. Let's look at the tummy first.
All right.
This is a woman. She was 47 when she came to me. She'd had 2 children. She was very active. She plays tennis 5 days a week. She's a superb player. She is really fit. And you would expect to see that she had cut abs and just looked terrific. And yet, when she put on her tennis clothes, she had to be careful with what clothes she picked because she didn't like the way her tummy looked. She had a round lower tummy. Look here. Look
Interesting. So that's after pregnancy.
This is after 2 children. Look how rounded her lower tummy is. She doesn't like this extra fat she has over the hips. She has looseness of skin over the love handles. She's really not that heavy. She's kind of slender across the upper tummy. Her belly button is kind of flattened and compressed horizontally. She just does not have an attractive looking tummy. And the reason she has this is because with the growing baby, with pregnancy, the tummy muscles stretch out. The way we're all constructed, internally we have a layer like a barrel of muscle that wraps all the way around, and inside are all the organs. And with pregnancy, that muscle layer bulges. It gets
so like the
stretched out.
six-pack is stretched. Is that right, in a way?
It is right. It is right. The muscles become looser. And in fact, the muscles on the belly don't cross the middle. There's just a layer of tissue that holds things together. And with pregnancy, that very frequently stretches out and doesn't go back. So that after pregnancy, the tummy is looser. The shape is...
So nothing she can do, by the way, to get rid of that?
There's nothing she can do to get rid of that.
Okay.
She has loose muscle layer. On top of that, between the muscle and the skin, she has extra fat. Some of that is genetic. Some of that is hormonal changes. As women, or even men for that matter, get past 30, we all have a tendency to gain weight. In many people, in most people, it tends to go in the tummy. In women, it also tends to go on the hips and
So what do you do
thighs.
for that? Okay, so you're there on the consult. In your mind, go ahead.
So when this woman came in to see me, she said, I don't like the way my tummy looks. I don't like the way my clothes fit. What can you do? So I pointed out to her how the muscle was loose, the muscle was stretched. She has extra skin. All the exercise in the world can't make your skin shrink. We like to think that toning it will make a difference. We can tone our muscles. We can't tone the skin. Once it's stretched, it's always stretched, and it's always going to be loose. And the only way to treat this is with a tummy tuck.
Okay.
What I did for her was to tighten the muscle layer. We put in some permanent sutures that stay there and give long-lasting support. It's like having an internal corset that helps hold things in and help hold the tummy flat. We take out the fat. We actually cut out some of it, and we use liposuction as well to get a more subtle shaping. And we remove the extra skin. For this woman...
So with her, the skin is actually removed in a certain area.
We actually remove the skin from the pubic area up as high often as the belly button. We were able to remove the majority of her stretch marks. And as a result, we're able to do this. Look at the before and look at the after.
That's a perfectly flat stomach.
She has a flatter stomach. It almost looks like she's taller. We have tightened the muscle. We've removed the extra skin with a number of the stretch marks. Look below the tummy. She has many fewer stretch marks, and they're lower down on the tummy. Look how you can see her belly button again.
So where do you hide those incisions? Where do you hide the incisions?
Well, the incisions hide under a bikini line.
Okay.
And she has...
That's pretty low.
I like to make it as low as possible.
Okay.
Hiding that scar is important. Nobody likes scars. Women are usually more than willing to put up with scars if they can get a nice shape. In plastic surgery, shape is everything. And if we can get the right shape, women are willing to put up with scars, even though with this woman,
but they're hidden.
The scars are hidden very nicely. We also did some liposuction to thin out the hip area, and it gave her a more taut, toned shape. And now she's able to wear a more, shall we say, flimsy tennis outfit when she's on the court.
Okay, right, yeah.
And she feels better about herself. In fact, let me show you how she looks from the side. So, same woman again. Here she was before surgery, and you see, look how soft and flabby her lower tummy is. It looks rippled. You can see how much loose skin there is. You can see the stretch marks. After, you can see her tummy looks tighter. It looks flatter.
Yeah.
It's smoother.
Looks good.
And what I like particularly about this operation for her is that it's changed her posture. When we tighten the muscle, it rebalances the muscles between the tummy and the back. And
so you stand up straighter?
Women stand up. Look at the shape of her back. She's standing in a different posture. We don't coach people when we take photographs. This is just how she stands. And the interesting thing
very interesting.
Among other things, what's very interesting to me is how many women tell me that their low back pain is better because they're standing differently. The muscle balance has been changed in such a way that they're more comfortable. The back doesn't bother them as much. They find that they don't stand as much like a sway back. They're standing straighter. Plus, there's also a psychological component that makes women stand differently. When we feel better about ourselves,
there we go.
We hold ourselves differently. We stand up straighter.
This like woman, charisma.
We do. That's right. This woman stood taller. Not only because her muscle balance had been changed, but because she felt better about herself. And interestingly, she was in to see me this week. This operation is a few years ago. She was in to see me this week. This woman said she's playing the best tennis of her life.
Because of her mommy makeover. Okay, well, good. That's good. Now, you brought other photos. And by the way, if you're just tuning in, we're talking about mommy makeovers with board-certified plastic surgeon Dr. Cedars. And these are some pretty good photos. Okay, what are we looking at here?
This woman's 38 years old. Young woman. She came in, she'd had 3 children. Her weight was close to normal, maybe 5 or 10 pounds above what she thought was her ideal weight.
Wow.
And yet she told me she felt like she looked much older.
Is that common, that stretch marks that are covering all the way across?
Randy, you usually don't see it because a woman like this won't show it to you. These are very common.
That's a good point. Okay, so they're not going to the beach and things like that.
Right. The majority of women that have had more than one child, and sometimes after a single child, will have stretch marks. Our skin is not very forgiving.
So you're cutting it out. I mean, how much worth of stretch marks can you get rid of?
We are removing a patch of skin that for many women involves all of the skin from the pubic area up to the belly button.
All right.
And for most women, that encompasses the majority and frequently all of their stretch marks. So this patch of skin, this island of skin, which is the most stretched out, it has the most stretch marks, is gone, thrown away, vanished. The skin from higher up on the tummy is pulled down to replace the extra skin that's gone away. And as a result, let me show you afterwards.
All right. Big difference.
She still has some stretch marks, but they are much lower down on the tummy.
You lifted her breasts too. We can't show the breast on TV, but this is very nice.
You can see, again, look at the shape of the belly button. Look how before surgery, you were unable to see the belly button.
It doesn't even look like the same person. I mean, this is like a very young person. If you look at that abdomen, that's young. And this is like an older person.
Randy, this woman complained to me that she felt she always looked pregnant. And she felt she always looked older. And after surgery, this is a younger tummy. This is what we all, men and women, consider to be an attractive-looking body because it looks young. We are all programmed genetically, and some would argue also culturally, to regard a slender young woman as being attractive. And what makes that attractive? It's having a slender abdomen, a slender waist, a flat tummy, and well-proportioned hips and breasts. Pregnancy, unfortunately, with all the goodness of having children and the joy we get from them, leaves a body that looks older. The skin is looser. Women complain that their tummies don't have the same shape. They don't feel as sexy. They don't feel as pretty. And yet, when we can restore a younger look, when we can restore something that looks prettier, women feel better about themselves.
Does this give them leverage to start eating better and just taking better care of themselves? I mean, do you find that?
I see this all the time. In fact, very frequently after women have this operation, I encourage them to change their eating habits, change their exercise habits. I actually have books in my office on eating and on
You're a
exercise.
fit guy, by the way.
I try.
I know your age. You came here, you changed, and I mean, you're in world-class shape.
Well, thanks.
You couldn't tell with that suit on, by the way. So you live this stuff. This is good. So you tell them about nutrition and about healthy eating and taking care of themselves.
I think it's the whole package. I want people to be healthy, not just have the illusion of health. Plastic surgery can sometimes give the illusion, and that's wonderful. But this is California. I like people to really live that. And so I highly encourage them to watch what they eat and to exercise to maintain this kind of result.
Now we're going to take a quick break. We come back, more photos, very dramatic. Are we saving the best ones for last, maybe?
Absolutely.
Okay. We're talking about Mommy Makeovers today with Dr. Cedars. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about Mommy Makeovers, who's a candidate, and with us we have board-certified plastic surgeon, Dr. Cedars. Okay. You said we forgot a few things about the last photo in the last segment.
Yes.
Okay.
Let me show you this woman. Look at her thighs. Look at the lower tummy. Look at the loose
So there's a big
skin.
crease. There's a crease.
There's a crease here in the lower tummy just above the junction with the thigh. And look, she has this couple of creases where the tummy joins onto the thigh. There's looseness of the thigh. There's this sagging that's on the outer edge of the pubic area. And if you look at this woman's after photos, let me show you again here. Notice that the junction between the tummy and the thigh has been smoothed out.
It's flat.
It's flat. It actually gives a little bit of a lift onto the upper thigh. And this fullness, this what she would call a blobbiness on the pubic area, out to the side of the pubic area, has been smoothed out.
And these incisions, I mean, they lighten every year, right? I mean,
new scars are always pink or red, and they're visible because they're red. But in most women, by the time a year goes by, those scars have turned to white, and they fade out and are hard to see. This woman actually wore a bikini to the beach a couple months before these photographs were taken. Look at this woman from the side. Look at the extent of her stretch marks.
That is a big area.
Look what a matronly look her tummy has. This looks like a woman who could be 60, and yet she's far from reaching even 40. You can see, if you look at the lower tummy, the multiple creases where the tummy joins the thighs.
Yeah.
She has a bit of a pooch where that hangs down. And with this woman, we tightened the muscle layer. We were able to remove a patch of skin that went all the way up to the belly button. And so we were able to remove a large number of those stretch marks. And by having the skin tightened from top to bottom, it gives a bit of lift that actually extends onto the upper thighs. Let me show you. Afterwards, we were able to tighten the skin on the lower tummy and have that flatness extend actually down onto the upper thigh. You can see how much smoother is the junction of the tummy with the lower thigh. And for her, it changed her life completely. All of a sudden, she was able to have more of an outdoor life. She's wearing a bikini again. She doesn't have to cover up when she goes to the swimming pool. She's able to go to the beach.
Now, there's a lot of people, I mean, in this economy, okay, these are business people. Do you look at this as an investment in yourself? I mean, in a tough economy for the working woman, executive, whatever. What are your thoughts on that?
We all want to look good. Everybody wants to look good and feel good about themselves, and that translates into the kind of clothes we can wear. Women tell me that they are wearing clothes they haven't been able to wear in years because all of a sudden, after surgery, they have a flatter tummy. Things fit differently. They don't feel...
So a nice little skirt.
They can
perfectly
wear a little
flat.
skirt.
Because that's attractive, by the way. A flat stomach. Nobody would disagree with that. Men or women. I mean, you know, that's a good look.
Sure. Women tell me that their clothes fit better. They don't have the push of their tummy against the skirt. They're able to throw away some of the sacks that they found themselves wearing, and they're wearing fitted clothes more.
Tell me about this. Do they bring in their partners, their spouses, in on these consults?
I encourage them to do so. For almost everybody, talking about operations like this, talking about surgery in general, is a new topic, and it's a lot for people to digest. So I strongly encourage women to come in with their spouses.
Do they come in? Do they come in?
They do come in, or a girlfriend. I think 4 ears are better than 2, because people would hear things differently. People may miss things, and their husband may pick them up. So I think it's a great idea to come in with your spouse. Randy, let me show you another one.
Okay.
I have a picture here of a woman who was 70 years old when she came to see me. She'd had multiple abdominal...
What's going on there? What is that?
She had multiple abdominal operations. She'd had a hernia repair, and she still had a bulgy tummy. If you look at the lower tummy and around the belly button, you can see a large protruding bulge of fat. And also, although it's hard to tell unless you examine her, some of that is looseness of the muscle layers. She has a loose tummy layer because pregnancy has stretched out the tissues.
Now, when you see this, I mean, do you think, do you see the end in mind where you say, boy, this is going to be good?
I have a good sense of we'll be able to really give her a flatter, smoother tummy. It's interesting, at 70, I don't always expect to get a tummy as flat as I can with a 50-year-old or a 40-year-old, but we can often make a dramatic change.
The 70's young, though, today, as you know.
Well, we're all, as long as we're physically active, we can stay young till we're in our 90s.
Okay, so with her, what'd you do?
With this woman, we tightened the muscle layer. We put in some permanent sutures so she'd have some internal support so it would stay flatter.
Internal sutures,
forever.
Huh?
It's like having a corset inside under the skin.
Okay,
it's
all right.
When we removed the extra fat and we removed the extra skin, we actually tightened the muscle layer side to side to sort of lace things in like a corset. And we removed the extra skin from top to bottom. So the muscles tightened sideways, the skin's tightened vertically, and we throw away the stretched out skin. This woman, it's a little difficult to see on this view, has a scar that goes from the pubic area up to the belly button, and even
like right in the middle of her abdomen.
Right in the middle of her abdomen. And here's a picture of her.
Oh my goodness!
We were talking about how new scars are pink.
This is very interesting.
And you can see that this woman, we were able to flattened her abdomen considerably.
That is an extreme makeover. This is, she's got to be thrilled with this.
She's very happy. She's able to wear clothes that she hasn't worn in years. She moves differently. She carries herself differently. Look at the buttocks. Look at the junction with her back. Look how it's been smoothed out. She stands differently. She stands differently for two reasons. In part, we have tightened the muscle and rebalanced the muscle balance between the tummy and the back, so she stands up straighter, and she feels better about herself. So she carries herself differently. This is a woman who's used to having a pair for a tummy.
So how long did she go in the before photo? How long did she walk around with that kind of a abdomen?
Randy, this woman had looked like this for probably 15 years or longer. This is just the shape that many women come to accept as being normal.
But did she hate it? She hated it.
Of course she hated it. She found that the clothes she could wear made her look like an old woman. These days, 70 is not that old.
Yeah.
If you're physically healthy, you can live an active lifestyle. And if you're physically healthy, you can have surgery so you don't have to walk around looking like this. You can have a flatter tummy and wear clothes that you couldn't wear.
Is this one of those things? Is this one of those things where they say, "Doctor, I should have had this done years ago"?
This is absolutely an operation where this woman said she felt like she should have done this years ago.
So why don't they do it though? They don't know? Worried about pain? What is it?
People don't know. They don't realize that something can be done. I think they don't ask the question.
Do they even say that to you? What can you do, Doc? Are they surprised that you could do something?
Most people don't know what can be done, but they're hoping something can be done. They've realized when they look in the mirror that they're tired of walking around like this. They want to be able to wear different clothes. They want to be able to be physically active. They want to be able to look in the mirror. They want to be comfortable seeing how they look with the lights on.
Now we're out of time. Good stuff, by the way. Breasts.
Randy.
What do you want to say about breasts?
Randy, all women like to have attractive breasts. Breasts almost define what it is for many women to be a woman.
Okay.
And pregnancy really changes the way the breasts look for many women. Women complain that their breasts are sagging, they've lost volume, they're deflated, they're drooping down, they look in the mirror, the nipples are pointing down to the floor. Women tell me they feel like they're looking at their grandmother's bodies. And they want to look young, they want to feel sexy again. So when a woman comes in with these concerns, I really have three goals. One, I want to lift the breasts. I want to move the breast mass from the lower part of the breast higher up on the chest wall. And often I will fix it there by passing it under a strap of muscle to help hold it high up on the chest wall. Secondly, I want to move the nipple up into a younger, perky position. And we do this leaving the nipple attached to the breast so that we can almost always maintain feeling in the breast.
Okay.
And thirdly, we want to remove the extra skin. We want to get rid of the sagging look. And I like to do that in such a way that we can give a younger, more compact breast. Many women that come in tell me that they feel like their breasts have a wide matronly look. It's sort of spread out to the side.
Okay.
And when I remove the skin, I like to make the breast less wide. I like to make it more compact. Contrary to myth, a breast does not have to be big to be sexy. It has to have a nice shape. Sexy breasts come in all sizes. It's a matter of the shape.
So you want to give them the shape back.
We want to make it a youthful look, which is almost synonymous with sexy. We want a compact breast that doesn't sag, that has the nipple in a perky position, and that sits up on the chest wall. When a woman comes in to discuss her breasts, oftentimes I will sit with them with photographs and say, do you like the size your breasts are? Do you want to be larger? Do you want to be smaller? And that is almost the most important thing other than sagging. And so for some women I will do a breast augmentation to give them volume that either they never had or that they lost, perhaps with pregnancy. One of the other nice things about breast surgery is when we're doing a breast reduction operation, women complain that they have had big, heavy breasts for years and years, and they're tired of it, they're uncomfortable. And one of the side effects of making the breasts lighter and lifted is that their back pain often goes away.
Really?
Low back pain, the shoulder strap pain, the grooving. That operation, breast reduction, produces the happiest patients in plastic surgery, hands down.
Okay, and you do it one day. Mommy Makeovers, we're talking about safety, and we're out of time, but you're big on safety. Tell me about that in your center.
Safety is first. Safety is always first. We operate on patients only that are healthy. We need to be sure they're healthy. We'll check with their doctors to be certain that we're operating on people that are in a good position to undergo surgery. I work with a board-certified physician anesthesiologist so that safety is first. Comfort and safety are really the most important things in how we do this. We want to be sure that women return to their lives as quickly as possible, that they have a short, comfortable recovery, and that they go on to their new lives.
It's good stuff. Final message. Somebody watching this, woman watching this, doesn't like the way she looks after pregnancy. What's your advice?
Come in, have a consultation. Tell me what you don't like. Tell me what bothers you. Let me take a look, and I'll make some recommendations. We can discuss options. Not all women need big operations. Sometimes a smaller operation can give a woman just what she wants. It may be liposuction instead of a tummy tuck, for example.
Okay. So 70-year-olds, 75-year-olds, what's the oldest mommy makeover you've done, which is combo breast and tummy tuck and lipo?
70 years old.
70.
But the limitation really is merely being in good health. And these days, there are so many fit people for whom staying healthy is a top priority that there's no theoretical upper limit.
Well, thank you for coming on the show. And all of these photos are on your website.
They're on the website, yes. Women can go to drcedars.com and look at the pictures. They can come in and
Well, you have an
talk to
impressive
me.
background, by the way.
That's very kind. Thank you.
Big resume here, CV. And we didn't mention you were voted, best doctors by your peers.
It's very flattering to be on some of the best doctor sites. I'm not sure what it means, but I'd rather be there than not.
All right. I want to thank you for coming on the show. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. Just put in Cedars, Dr. Cedars, Mommy Makeover. You'll find them there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.